welcome to my office. I am an oriental medicine practitioner and I have been working in South Korea for more than 35 years. I have seen a great number of patients with difficult disease, and I have to take care of them with natural protocols, because natural therapies, natural protocols is exactly what we provide for our patients. Now let me explain to you one of my patients who have been diagnosed as variant angina. As you know well, the variant angina is very difficult problem to most patients with this problem, because even though the patients take the prescription drugs, the symptoms of angina does not disappear at all, because the pathology of the angina is a little bit tricky to understand, and the prescription drugs which is given by the conventional medical practitioners is not enough to get off the symptoms of the variant angina. And this is exactly what most patients with angina have to experience on their everyday life. So I just want to emphasize that natural protocols that is done in my office is very wonderful and very effective to be able to remove almost all the symptoms of various angina almost completely, and many patients will feel very satisfied with what they got from my clinical practices. Actually, if patients keep working with us for a long period of time, I'm sure that most patients with variant angina will feel very satisfied, and they feel themselves being free from the symptoms or pathologies of angina completely, and this is exactly what we are going to work for. One of my patients, who is a male and whose age is over 60, have come to my office 3 months ago. He had been diagnosed as variant angina for 2 years ago, and he had been on the prescription drugs for about 2 years too. However, even though he had taken the prescription drugs for 2 years, he was not able to free from the symptoms of variant angina. He still had to be through a lot of difficulties, including the chest pains, the poor concentration, and difficulties breathing. And these are the examples of the symptoms of the variant angina who take the prescription drugs. So I just like to explain how we can approach the problem of the angina at the root causes of the disease, and how we can remove the fundamental pathology or underlying causes of the disease by natural screening tests and natural protocols. One of the most important things is that most people with angina have to completely free from smoking cigarettes. As you know well, the smoking cigarettes is certainly the most important factor for the development of the angina. So everyone with variant angina and other anginas as well have to be quit smoking cigarettes completely, and this is the most single important factor we need to understand. Now let me explain how we can approach the underlying causes of the disease with natural screening or diagnostic tests, and how we can remove the fundamental and underlying pathology of the disease. This is the image which is designed by us. This image especially represents some of the problems that the patient have in his body, and especially the pathological problems that is related to the causes of the angina pectoris. So now let me explain what we can learn from this image. Well, this is represents the torso or trunk of the patient's body, and we can easily determine how many problems he has in his digestive tract as well as in his toxicities. Well, the tenderness over his whole abdominal area represents that he has a lot of toxins in his bodies, and the general toxicities of his body is really existent in the patient's body. And you may ask what the toxins has to do with the development of the angina. Well, we firmly believe that the toxicities of various kinds of heavy metals, synthetic chemicals, or other toxins as well may be the underlying causes of the variant angina. So by removing these toxins from the patient's body, we can make the patient feel much better, and this is exactly how we work with our patients with variant angina. Now let me approach some other diagnostic tests in order to confirm the existence of the toxicities in its body, and we will explain later what type of herbal formulas will be used for the patient's body. Well, this image represents the hair mineral test. The hair mineral test is widely well known among medical practitioners as well as most people. So by analyzing and interpreting the hair mineral test, we can also approach at the underlying causes of the variant angina. Now, this is the mercury bar, and this is the arsenic bar, this is the aluminum bar. In the patient's body, there are variety of toxins, including the mercuries and arsenics and the aluminum, and this has been confirmed by the analysis of the hair mineral test. Now, it is necessary for us to make the patients avoid the mercury toxicities, arsenic toxicities, and aluminum toxicities. Now, in order to do that, we have to remind our patients of the existence of the toxins in his body and how to remove them from the patient's body, as well as how to avoid them in his everyday life. Well, as you know well, the mercury has been a serious factor in the fishes of the oceans, and especially the large fishes, including the salmon and tuna and sharks, are the examples that has a lot of contamination of the mercury toxicities. So we need to avoid these fishes from our dining table. And arsenic is also represents various and the arsenic toxicity also may have a great influences on the coronary arteries of the disease. So removing arsenic is also one of the most important things. In order to remove arsenic from the patient's body, we have to learn that arsenic is contained heavily on the brown rice. You may like the brown rice than the white rice, because most people think that the brown rice has more nutritional values than the white rice, so most people prefer the brown rice to white rice. But I would recommend in this case the preferences for the brown rice have to be limited to a considerable degree. This means that we have to recommend the brown rice to be reduced in the table as much as possible, because the brown rice has the strong possibility that the brown rice may be contaminated with the considerable toxicities of arsenics. So preferences for the white rice is much better than the brown rices for this reason, especially for this patient, and this is the information that we can learn from this hair mineral chart. And aluminum toxicity is also a problem to the pathology of the coronary disease. So I would recommend most patients with variant angina with this problem have to avoid the aluminum toxicities as much as possible. So we in our clinical practice, we use some herbal formulas that will strengthen the yin energies or yin forces in the patient's body, and this will make the balances of the yin and yang energy more confirmed and much more balanced, and then the patient will feel much better. Another thing that is more important is that we have to use some nutritional supplementation in order to remove mercuries, arsenics, and aluminums as much as possible from the patient's body, and this is also why we use some nutritional supplements for the patient with variant angina. This patient with variant angina have felt much better as he worked with us for about 3 months, and the patient almost feel free completely from the symptoms of angina, including the difficulties of breathing and chest pains and the shortness of breath, as well as poor concentration and difficulties in moving his bodies. So the patient feel really very much happy with our program, and I'm sure that if he keeps working with us afterwards, then the patient will feel completely free from the variant angina, and the patient will feel much stronger and much healthier in his angina problems. Thank you very much.